questions.
Okay, go ahead.
All right. Our presentation was called Cancer's Off Switch, and it's essentially goes into detail about immunotherapy, and we're gonna get into that. So it starts off with a girl named Shirley. She's 22 years old, and she's had that's not Shirley. I wanted to protect patient privacy. But she had a nagging cough, and she went in for x-rays, and they found malignant skin cancer at multiple spots in her body. And so she went in for the normal treatments, chemotherapy, radiation, and after 2 years, there was no relief from the cancer. So researchers, meanwhile, had been asking a very important question, and a question that's been asked for a long time. It's what if you could help the immune system respond to cancer cells? This started about 100 years ago when William Coley, it was a doctor, and he noticed that his cancer patients actually lived longer when they had developed an infection during their cancer treatment, rather than ones who didn't have an infection. And so then he tried to stimulate, it sounds kind of weird, but give people infections, almost like a vaccine, in order to try and help them live longer and have their body fight the cancer cells while it's trying to fight whatever antigens were in their body. Luckily for Shirley, immunotherapy is a new method for treating cancer that uses the body's own immune system. Immunotherapy really works by taking away some of the brakes that cancer cells can apply to the immune system, and so that you can eventually have things like this, where there's T cells that are attacking a tumor cell in order to kill it. The body's own immune system consists of T cells and B cells, which are the adaptive immune system, and also it has macrophages, dendritic cells that are part of the innate immune system, which are the body's kind of like shotgun approach to getting rid of pathogens. But then also the T cells and B cells are more specific, and they have a little bit of more memory to them when they are attacking pathogens. And this is more about the immune system. These are, like we learned in class, these are the antibodies, and they're attacking a pathogen, and they would latch on to these antigens that it would notice in the adaptive and innate immune system.
Thank you, Dan. So as he mentioned earlier, there are proteins that are kind of the brakes for the immune system, and there are two different types of proteins. They are CTLA4 and PD1. CTLA4 is cytotoxic lymphocyte associated protein, number 4, and PD1 is programmed cell death protein. And so basically these proteins are actually good. They're good for our body. When the immune system is doing its thing, the T cells, and attacking foreign substances, if it weren't for these proteins, the immune system would go haywire. They would attack anything. That you would have autoimmune attacks in the body, and it could basically kill the person. The immune system has that capacity. So God invented these proteins in the body, and the CTLA4 acts like a brake, so it slows down the T cells response. And if that doesn't work, you have PD1, and like its name says, it triggers T cell suicide. So it kills off the T cells. Now, the issue here is when someone has cancer, you want the immune system to attack the cancer. You want it to help degrade all these tumors. But then you have these proteins kind of calming down. The proteins, they don't really care about the cancer's presence in the body. They just care about calming down the immune system and putting the brakes on it. So that's the issue that we have here, and that the author and his team are faced with. So they propose an idea. Well, in cancer patients, what if we could temporarily disrupt that break? What if we could block these proteins temporarily so that the immune system can, continue doing what it needs to do against the cancer? So, antibodies have been created in order to temporarily disable the CTLA and PD-1 proteins. You have two antibodies that were created. You have ipilimumab and, sorry, I guess the other one is next. The other one is called nivolumab, probably pronouncing it correctly. But the ipilimumab is the one that blocks the CTLA4, and the other one is called nivolumab. It blocks the PD-1 proteins. They are a monoclonal antibody, so they kind of act like a key and a lock for these proteins. They lock them away temporarily, so that the T cell can, continue going into the antigens and, degrading the tumors and things like that. So, does it work? Yeah, there are actually studies that were shown. UC Berkeley, Yale, and even some biotech companies like Bristol Myers and Squibbs, I don't know if you've heard of it, they actually conducted studies on patients. They first started with mice. They showed the mice that had melanoma and sarcoma, when they used these antibodies, they showed some tumor regression in the mice. So and that was really good news. That was great news, actually. So they went on and they actually conducted studies on some patients. The majority of the patients, they had melanoma, but there are actually some patients that had lung cancer as well. And the way they saw that it worked, it was a bit misleading to kind of figure out whether the antibodies were working or not, because 12 weeks after treatment, some patients showed tumor regression, some didn't show anything at all, and some actually showed new growths. So that was a bit concerning. And the theory as to why they think some patients had new growths in their body was that there was a flooding of T cells and lymphocytes on the tumors as soon as the antibodies were in effect. So things were a little bit crowded. So when they used bioimaging like CT scans or MRI scans, they showed these clusters of things where the tumors and the cancers were. So they thought, oh, well, it might take a little bit more time to see it actually affect. So instead of focusing on the tumor regression, they were focusing on the survival rate of people. And they did a study on patients who took the ipilimumab antibody and patients who had melanoma. I think it said about 20% of patients lived 3+ years versus patients before, when this antibody didn't even exist, they would live 7 to 8 months. So that's a huge difference, and that's a very good sign, actually. We see it's actually working. Now, immunotherapy offers safer alternatives to cancer treatments, but can still pose a few problems, like with anything, unfortunately. The pro to taking these antibodies and using immunotherapy is you don't have to deal with the side effects of chemotherapy and radiation. I think I was looking up on the National Cancer Institute, some of the side effects you get with chemotherapy is nerve changes, hair loss, uncontrolled bleedings, all those things. With chemotherapy, yeah, you are attacking cancer cells, but you're also attacking the healthy cells that we have in our body. Versus immunotherapy, you use the body's own natural system to attack the foreign objects. The thing with that is you have autoimmune attacks, unfortunately. And one of the common symptoms of autoimmune attacks is inflammation. You have inflammation of the organs, of the skin, but there are also drugs like prednisone and corticosteroids that are anti-inflammatory agents. So you kind of have to weight the cost in a way. You know, immunotherapy, yeah, it's developing, and they're still trying to figure out ways to harness it, to even use the antibodies together and use it alongside chemotherapy. But like with anything, you still have risks and consequences. So thank you all for listening to both Danny and I. If you have any questions.
Is this something that you could like inject into like a localized area, or is it because it's like it has to go through the, like, does it have to go through blood, or, and like, because if it has to go through blood, then it's going to obviously spread to the whole body, but is there ways to like put it in a localized area, or is that
Well,
not
from what
really?
I've read is the way they inject these antibodies is through IV.
Oh, okay.
So I'm not sure if they
Gotcha.
figured out a way to localize it. Yeah.
Right. Because if it's in blood, it's pretty tough.
Yeah.
I think
know.
it's also something that you'd want to kind of spread out, just so you get like, because this is for metastasized melanoma,
Yeah.
so you're not exactly sure where all of it has gone. I know,
Right, totally.
in Shirley's case, Shirley did actually end up living for way longer than,
5+ years.
Yeah.
Forgot to mention.
yeah, way longer than she was anticipated or expected to live. But for her, there was multiple spots where it needed to go, so a local treatment wasn't necessarily the best option.
Right.
Is there any way to like distinguish the cancer cells from the rest of the body? Because like, does this kind of stop the immune system just like in general?
Wait, what was your question? Can you kind of clarify?
Like the antibodies that you guys are talking about, it stops the immune system from like stopping, like for everything, or just for cancer cells? Is there a way to specialize it so that it knows to attack cancer cells and not to attack anything else?
The body naturally sees cancer cells as like a foreign cell or a foreign agent, but cancer cells also possess kind of the ability to stop the immune system from like attacking it. I'm going to go back to this slide real quick. This is the tumor cells, and they have a trigger. So normally this is a T cell that would attack the tumor cells because they're foreign agents, but the tumor cells have a this one that binds to or it's a PD-1 receptor or PD-1 antigen, and that binds to the receptor, and it causes the T cell that would normally start attacking the tumor cell, it causes it to have cell suicide, which doesn't allow it to do its normal function. So that's why the tumor cells kind of like halt the body's own immune system. I guess that answers your question.
And also in response to your question, I think the antibodies in general prevent these proteins from doing their job in the immune system. And when there's cancer present, the immune system will mainly target those cancer cells because they, like Danny said, it is a foreign object. But yeah, unfortunately, the immune system is a bit more complicated than that. So you're gonna have autoimmune attacks in different places.
Is that how they eventually end up dying? Or is it like the autoimmune attacks, is that why they die after like 3 years or something?
No, it's normally just some of the patients have been continued living.
Yeah.
Some of them didn't have necessarily the same success as others, but that's pretty typical in cancer studies. Is that some patients are just have like a presupposition to just have like a little harsher cancer. But the inflammatory response is just kind of natural when you have like an autoimmune type response in your body. You're gonna get inflammation, and you're gonna get like that type of response.
I don't think it's as powerful as an autoimmune disease.
Because it's temporary.
Right.
When you stop giving these proteins, your body will go back to normal. So once the cancer has gone into remission or is gone, then you can stop giving these proteins, and then the inflammatory response will go away slowly.
Right, it would practically go
Thank you. It was great. Yeah.